The following events were recorded as they happened at the Hospital for Sick Children in Toronto. In this episode of Life's Little Miracles, Kaylee's open heart surgery. Five-month-old Kaylee was born with tetralogy of Fallot, a malformed heart. Her condition results in dangerously low oxygen levels and a rapid heart rate.
I'm just going to measure, for oxygen.
Kaylee must undergo surgery to repair her pulmonary valve and close a hole in her heart if she is to survive.
Okay, so
Today, she will be examined to ensure she is healthy enough to endure both the operation and the difficult recovery that will follow as her body tries to adapt to the heart repair.
Yeah. So I was just reviewing some of the notes that we got from the clinic visit. So I understand that Kaylee was diagnosed while
I was pregnant, 4 months.
Okay. And did she have any problems when she was born?
No.
Okay. So how has she been since going home?
Good. She really, I guess there was one episode that we thought that maybe she had a blue spell, but
Did you have to put her knees to her chest at all?
Yeah.
And she came out of it okay?
Yeah.
Okay. And do you remember how long it lasted?
Do you?
Seconds, minutes?
Yeah, not
Seemed
minutes.
like hours.
Seemed like I'd say more minutes
Sure.
than that.
Okay.
No.
How is she when she's active and playing? Does she get sweaty or does she get blue to you at all?
She's the older she gets, the more I notice that she gets blue around the lips, especially if
Okay.
she's upset about something.
Okay.
And as far as I just noticed that she's getting clammier.
Okay. And is that when she's active or
That could
just
be both.
anytime?
Yeah.
Okay. So I'll examine her. I do need her to lie down just for a minute so I can feel her tummy and her little pulses in there. Just very gently, of course. Does that tickle your tummy? Does that tickle your tummy? Okay. Actually, while she's just like that, I'll have a listen. She's quiet. Great. I'll see you after the operation. I'm part of the team
Oh,
that
are
will be
you
caring
okay?
for her when she comes back
All
up
right.
to us
Okay.
after the ICU, so I'll see her then.
Say bye, Paula, for now.
Bye-bye.
Thanks a lot.
You're welcome.
So she's going to be sitting on the bicycle seat,
Okay.
and then you're going to pull the arms up in the air like that.
Oh, okay.
And then then we're going to close this thing over.
Oh, and a test.
Yeah.
She's fine. Oh, she's eating it.
Okay.
Does that taste good?
Okay, that's it. She's done.
Is she done?
Yeah, she's
Let's get
just
rid of this.
hold hands like that for me, please.
Oh,
And she's all done.
There. Pull it back.
And just wait outside for me. Okay?
Nice to meet you. And this is Nick.
Hi. Can we go in?
Yes.
Okay. So I'm sure you've gone through a lot of teaching, so I'm sure
Yes.
you know a lot of what I'm gonna say.
Right.
How was the diagnosis
It was
made?
the fourth, when I was 4 months pregnant, that's when
Okay.
they did the ultrasound and had discovered that there was something not right with the heart.
Okay. The problem is that there is a hole between the right and the left heart,
Right.
between the ventricles, and there's also a narrowing of the exit of the right ventricle. And the purpose of this surgery is to closing the hole between the two ventricles with a patch. We also open up the arteries, the pulmonary artery,
Right.
and we look at the valve inside and just make the pulmonary arteries bigger. The risks of the operation: lung problems. After the surgery, she's gonna have tubes,
Right.
and some tubes can to collect the fluid around her heart. She can have pleural effusion, so and lung infections also,
Right.
and bone infection are also complications of a surgery like that. I'll ask you to read this. This is the consent
Okay.
form, and it says that I've explained to you the surgery and the risks, and that you agreed to it, and you have to both sign for it. Okay. Okay. Very good. So the surgery is planned for Thursday morning. Do you have any more questions?
No.
Are you okay?
What's up? When will they start to get her ready?
We're gonna start getting her ready now,
Okay.
actually.
Okay.
I'm gonna just take some vital signs and get her already in her outfit.
Yep.
She a good girl?
Yeah, really good. Did you have any questions?
I don't think so.
Hey, Kaylee bear?
Hi, I'm Dr. Holtby. I'm one of the staff nurses. Hello, sweetie.
Who is that?
Do you guys have any questions? or
I don't
anything?
think so, no.
No, you've been talked to endlessly, I'm sure.
I love you. I love you, yes. Don't cry. Don't cry. No.
All right, Dolly Doo, come on. There we go. There we go. There we go. That's your copy. Yeah,
Yes.
that's your copy.
Yeah.
All right, let's go find the rest of the troops, shall we? Come on. It's not good. It's fine. When we use
put it right under the warming blanket, which I can come from the other side and do.
So Martine, you went off the bottom, right? 'Cause that's the lowest.
Yeah,
You're happy, okay.
that's good. So that's just sawing open the breastbone. So the first thing we do is get ready to go on a heart-lung machine. And that allows us to completely bypass the heart and give blood to the brain and the body while we stop the heart. Okay to divide your lines?
Go ahead. Okay to transfuse that blood back?
Yes, it is.
Thank you.
Okay. That's good. I'd like to look at the pulmonary valve first. So now we're just opening up a housing around the valve to see how the valve looks inside. Sometimes the housing's bad, but the valve itself is better than the housing. So the bands always run along that line right there. Make sure you're far enough away from the aortic valve. You really have to be careful of that right corner there. It's really strange. That up, that's good. There's the valve, and to me that looks like a valve we can work with, so we're going to spend a little bit of time fixing it. The opening of the valve is small, but the very base of the valve, down where it attaches to the heart, is a pretty good size, so we slit it open a little more. There you can see we've slit it open. That's given us a couple more millimeters. and cut into the ventricle just a little bit. And that's a much better looking valve. So I'm still not sure it's going to work, but we at least have a chance at it. I'm putting this patch in. This is a patch we'll put in. It's just about right. Mosquito. So now we're going to take the clamp off to the aorta so the blood can go back to the heart, and the rest of the operation we'll do with the heart beating. Drop your flow.
Slow down now.
So now heart's going back to the, blood's going back to the heart. In a few minutes it'll start beating automatically. And you can see the heart gently starting to beat again. The right heart is strained though.
She isn't really a substrate. I mean, I'd be
No,
surprised.
but she has small PAs. It looks to me like it's stressed a little bit. Wow, blood pressure is 100. Let's measure it now.
This is about the level of the valve.
It's no better.
Okay, let me see. I can see the PAs.
Well, the only thing is there orifice stenosis of the branch PAs that we
Yeah,
should
I'm
deal
gonna
with.
see if
That's all. And then maybe I should go, if we're going to have RV pressures this high, maybe I should leave an ASD.
Yeah, that might be an idea. It looks really good. Maybe for a second. It looks really good.
It's hard to believe you can get that to look any better, isn't it?
For a second. It looks really good.
Pickups, please.
I'm letting it kind of drift down.
Put the
11.
chest tube in and facer wise. I'm going to go make sure things are okay over there. Yeah. Kaylee seems to be doing okay.
Good.
We found what we expected and in some ways a little bit more. We fixed her tetralogy without any difficulties. Her own rhythm seems to be working.
Okay.
We closed the hole in her heart okay. Her pulmonary arteries, which we knew going into the operation, her branch pulmonary arteries are small. Each of the branches that goes to each side. And that is proving to make the right heart need to work harder than what I normally would like it to work.
Okay.
And the blood pressure on the right side is higher. Normally I'd like to see it around 40. It's up in the 50s, even the 60s sometimes. So at the moment she's doing fine, and we're going to watch her very closely. I'm
Anything for us to be alarmed about?
If she doesn't look like she's doing exactly the way we want to, then I may want to take her up to the cath lab and look at those arteries with x-rays to see whether there's something more I can do for them surgically or not.
When are you going to know about the pressure? Like, are you talking now? Are you talking next week? Are you talking
Whether
next
it
month?
comes down with time? The real issue is, does the body tolerate that kind of pressure? And that's the issue. Does she tolerate it in the short term when we've changed her physiology as much as we've changed it?
She's still got ice. She doesn't feel, she still feels warm. She's gonna be fine. All this stuff has to hurt so much.
Morning, Doc.
Good morning.
How are you?
Good, how are you?
Hello, I'll get out of your way.
Hi, how are you? Pressure has been around this sort of range. Trying to keep the systolic around 90.
Mm-hmm.
Cooled off a little bit around, she said around 7. And she's a degree 1.
And we tried to wake her up.
No, she still wants to relax. She she's been getting morphine, 40 mics, and then midazolam boluses. Because her pressure was going quite high, and she's
Well, she looks fairly good, but clearly hasn't fully adjusted yet to the new arrangement. So, I mean, what we see is that her heart is coping, but it hasn't gotten to the point where it's acting normal yet.
Right.
And what we would hope to see over the course of the next day or two is that it starts acting more normal.
meaning
Meaning that she just needs a little, the numbers that we see read a little more normal. Her heart rate comes down, the amount of fluid that we have to actually put in the heart for it to pump the appropriate amount of blood would be a little bit less. And it's just going to take a few days to play itself out, I think.
Back. How are you guys doing? So I had a chance to at least talk with the sonographer who did your little one's echocardiogram. Okay. And it sounds like everything's clear, and that there's no obvious obstruction. Okay. So everything looks clear, and then her repair actually looks quite good.
Oh, does it? Good.
And again, she's developed this chylothorax, which is this fluid collection. There's like a backup, and then you get release of the lymphatic fluid into the space around the heart and around the lungs. It's a little bit stressful. Most of the time we're able to get on top of it with other things. So, but she's doing well, that her repair went well and that everything along structural lines and functional lines looks great. That's all in her favor.
Right. Over the last week, I've learned to try to take one day at a time.
Right. No, that's the best thing right now. Could have been easier, but
We'll get through this.
she's just giving us a little challenge.
Yeah, no, from day one she has,
There
so
you
this
go.
is no different.
Anyways.
There's my smiley bear. There's my smiley bear. So wait here. There we go. Let's have a listen to your lungs here. Can we sit you up for a listen? Hi there, smiley bear. You sound good. So since Thursday, the x-rays have been fairly favorable. They haven't had any significant
No big
accumulations.
increase?
No, that they're worried about. There was a small one in the beginning, and I think you said the last one was better, right?
Right.
So, and then, we'll carry on watching the x-rays to make
Okay.
sure she doesn't reaccumulate now that she starts the collagen.
Hey, Kaylee, let's do this, then you can go
Okay,
home.
let's go, Kaylee.
Oh, sorry.
She's gonna act strange in her own crib.
Yeah, she is. Are you excited to go home?
Yeah.
There. Give them a smile. Yeah. Oops.
Yes, you are.
So the home care nurse is available. Yeah, tomorrow.
Sunday, right?
Yeah. She'll just probably gonna lock it and then change all the tubing on Monday.
Okay.
Yeah.
No, not back again.
I'm gonna turn on some music. Listen to this, listen. Can you hear? Listen to this. Can you see the light? You're used to this light. Yeah. Her heart rate is about 132 and a perfect saturation of 100%.
There we go.
I mean, is that what you asked for? A perfect child?
She looks great though. Look at her. Hi,
Billy, how you doing? Do I get a smile today?
Okay. So since discharge, she's done well. She's been pretty happy. She's a happy baby.
It depends on who you talk to.
Okay. And is she breathing fast at all for you guys?
No.
She's been pretty comfortable. So those are all good signs. What I'd probably do today is actually stop the captopril.
All right.
Either of the medications, like I said, you know, we put her
Little
on the
by little,
medications
right.
with the thought, you know, maybe something is going to work here. But that she's doing so well, I'd be apt to go ahead and stop one of them, okay? Yay.
2 down, 1 to go.
I know. All right.
All right.
Anyways,
Thank
it's
you very
really
much.
lovely to see you guys. And I'm really happy that she's doing so well.
Thanks, yeah, all right.
Okay.
Great, thanks a lot. Okay, thank you.
3 months after surgery, Kaylee no longer suffers from low oxygen levels or a rapid heart rate. Kaylee's progress will be followed by cardiologists, but doctors are hopeful she will continue to thrive. On the next episode of Life's Little Miracles, Kayla's scoliosis surgery and Lisa's kidney operation.